How's it going, guys? This is a special edition of the Pick Swap podcast. I'm James Birrane. I'm here with Sean Barnard as always. Sean, introduce our special guest for us.
Yeah, and we have a special guest today. We have Dr. Rami Hashish, who is the founder of the National Biomechanics Institute and founder of Chief of Technology Officer of Parento. Holding 2 doctorate degrees and a PhD in biomechanics and a doctorate in physical therapy, Dr. Rami has been retained as an expert witness for more than 1,000 occasions, examining injuries in sports, the workplace, motor vehicle, and aviation accidents. So we're super happy to have him here today and learn a little bit about the whole Joel Embiid knee injury and how the management has been going. So thank you for joining us today.
Of course, it's my pleasure.
So to kick it off, just kind of obviously Joel Embiid injuries have been talked about through his entire career here. And kind of the most notable of late has been the torn lateral meniscus, which obviously dates back to last year, and we're seeing the lingering effects into this year. So start off with, what exactly is a meniscus tear?
So the meniscus is this piece of cartilage or tissue that's basically between the knee, right? So you have your thigh bone, also called your femur, and then you have your tibia or your shin bone. So between your thigh bone and your shin bone are 2 pieces of tissue or cartilage that serve as shock absorbers, and those are your meniscus. So I actually have a anatomy model here. I think you guys can see it. So essentially you have your thigh bone, you have your shin bone, and basically these 2 blue circles, those are what's your meniscus. So those basically serve as shock absorbers to the knee joint. And then, of course, in the name, torn meniscus is just a tear of that cartilage.
Gotcha. And now, for what traditionally is the recovery for that?
So it depends. So it depends on the magnitude of the tear. So sometimes when the meniscus tears or the cartilage tears, it can be big, it can be small, and sometimes, if depending on the size and how it's torn, it can kind of latch on to the bone, and you kind of feel like this clicking. And so in some instances it can be really bad. In some instances, it's can have a pretty quick recovery. So rehab wise, if you have a torn meniscus and it's pretty bad, you could be anywhere from 3 to 6 months. Or in some instances, it may be much less than that if it's kind of a small tear. If you have surgery, then it can fluctuate depending on a bunch of different things, such as your size and what type of surgery you had and how bad was the tear and what they did. So kind of depends.
Gotcha. And we saw Joel Embiid soldier through the postseason and kind of play through the tear. Is most of that all just kind of pain management, or is there any kind of concern for making it worse or structural concerns there?
No, there's structural concerns. So that's the problem. Like you'd hope with a lot of these injuries that people kind of push through that it's just a pain management thing. But no, with the knee and with the cartilage of the knee, that's unfortunately not the case, right? So I'm just going to use that anatomy model again, right? So let's say you have a tear of that meniscus, right? If you have a tear of the cartilage, and so with every single step and every single jump and every single bang, you may make that tear worse. So it may increase the amount of tear. And then what's especially bad is if it starts tearing and kind of breaking down more and more, you end up having kind of this bone on bone action, right? So if you have bone on bone, then you can have a complete breakdown of your knee as a whole. And now you may start having some effects on the bone, at the ends of the bone, and having degrading of the ends of the bone. So it can really result in some long lasting issues.
Mm-hmm. And I guess the most interesting aspect of this to me is it seems that Joel Embiid elected not to get surgery on it this offseason. So is this something that just kind of goes away with time and he's able to rest it up, or is surgery required to fix it?
No, you don't need surgery required to fix it, but obviously it depends on the tear. So obviously I'm going to defer to the surgeons on that one. They probably saw something that they felt that it may not necessitate surgery or that it may be just an option. And then it's very common for people to opt against surgery, right? So one of the things, or what's commonly done in surgery, is what's referred to as a meniscectomy, where they basically take off a piece of the meniscus, right? So you're not getting that back. So it makes sense for an athlete who's in his prime, who's young, may not always want to jump the surgical route if it means that they're taking away a piece of my tissue, right? So you can't really fault them for that. But again, that's typically a collaborative decision between the athlete and the surgeon.
Yeah, and personally, to be honest, I think a lot of the decision making on Embiid's part is frankly just sick of getting surgeries, and he's a guy that's constantly been being worked on. So I don't think he was anxious to kind of go through more than he's has to. But one of the things that I kind of have been disappointed on is early on in the season, there's been a lot of occasions on him grabbing at the knee and like showing signs of pain, and he still has played through as much as he could. Obviously, he's gotten a break due to unfortunately testing positive for COVID and going through that. But during his time on the court, are these, do you think, lingering effects from just what's happening last year? Or is this something that he'll just figure out as he goes?
It kind of depends. So if you think of it, so there's that video from last year in the playoffs, I think, where he tore his meniscus, or they say that he tore his meniscus, where he kind of landed, then fell down on his butt and back. But typically, you don't have meniscus tears. They're not always purely traumatic. You can tear your meniscus if you have a lot of twisting and you have a lot of force. That can certainly happen, but they can also tear just over time. Like they degenerate, or you have bad body mechanics. You kind of load it improperly, or you load it consistently in kind of a bad way, and it can break down over time. So then it takes like less force and less of an impact to tear it. And I'm assuming that's the case with him, right? So specifically, he tore the lateral meniscus, right, which is the meniscus on the outside. So if you think of the knee, if my knees are kind of knock-kneed, right? My knees are knock-kneed. That means I'm placing a lot of pressure on the lateral meniscus, and I'm not placing a lot on the other meniscus. So depending on how your posture is, right? If you're knock-kneed posture and you keep jumping and you jump with a knock-kneed posture, that's going to put too much pressure on the lateral meniscus. It may break down over time, and then it may not take a big event to cause it to completely tear and have all of these pain and symptoms. So getting back to Joel, it kind of depends, right? He has to improve how he lands. He has to improve how he runs. He has to improve how he jumps. And that's not picking on him. That's just a standard thing. When people go through these types of injuries, they sometimes have to change the way in which they move to help prevent them from breaking down in the future.
So one question I have is, like, we see him go through all this process of, injury after injury, and he comes back in a different way every time. What do you think, or, what do you suspect as being a recovery process, or during a season where he's feeling the pain from these injuries? What kind of physical therapy or things is he going through on a daily basis to prepare himself to play?
I mean, I think he's doing a lot of stretching. I think he's doing a lot of mobility work of his IT bands, the sides of his hip. I think he's probably doing a lot of strengthening on the sides of his hips to develop the endurance and the strength of his hips to prevent his knees from falling inwards. And I also think he's doing some just generalized, a lot of like coordinated, repetitive motions, just to kind of practice and like in-game simulation, make sure that he's consistently landing in the proper form, running in the proper form, and kind of really working on his, like, the biomechanics of his motion. So it's not just a strength thing, and it's not just a flexibility thing, but it's kind of honing in on the optimal motions and movement patterns. And we can't forget that he's a big guy, right? Like he's a big guy. I mean, so he's putting a lot of stress on his knees. So it's particularly important for somebody like him than somebody who may be a little bit smaller in stature.
And one thing that became somewhat controversial last year with the offseason was just the brace he was wearing. And Joel obviously wasn't a fan of it. He spoke pretty openly about not liking it, how it limited his mobility. And frankly, the numbers backed it up with his jump shot not looking the same and things like that. Are braces kind of a go-to kind of technique for limiting damage with meniscus? And do you think something long-term that is an option?
Do I think it's a long-term option for him? I mean, certainly it's a long-term option because you want to stabilize the knee joint and you want to prevent the knee from falling in and out, and you want to kind of control kind of bad motions that he may regularly be exposed to or regularly perform. So yeah, knee braces are important. I think you see that also in the NFL with a quarterback if they hurt themselves, or a running back, but you also see it quite, regularly with offensive linemen because they want to kind of prevent the motion of the knee and promote the stability. Now, that doesn't mean that he's going to perform as well. I mean, because it does limit his mobility, and that's obviously one of his traits, is being, a bigger guy, strong, but still very mobile. And taking that away may obviously affect his performance.
Mm-hmm.
So, and then like to look at it this way now, he is getting this break, like the unfortunate break because of COVID. It's going to be about 10 or 11 days, they see. Is that like enough time period for, it's hard to tell, obviously, because you're not with him all the time. But like as a recovery period or just a chance to give that knee a break, like, is that enough time? Like by any means, is that close to enough time for him to come back at like full strength or close to full strength?
I think it depends on the extent of his tear. I think kind of the recent evaluation of his knee, they suggested that it was something really small. And yeah, I think the 10-day break, COVID is obviously terrible, but this may prove to be a blessing in disguise to his knee, because that extra time will certainly allow not only rest, but rehab. So no, I certainly think that this is probably beneficial, at least for his knee and his legs, certainly.
Yeah, 100%. And I mean, load management has been another kind of hot topic around NBA, but do you think kind of just limiting his minutes is also like a beneficial way in the future? Or do you think this is something that kind of, it doesn't matter how often he plays, it's just kind of if he's playing or not, or is like playing limited minutes a fair way to kind of conserve him?
I don't think limited minutes is the way to do it necessarily. I mean, so when people get tired or when people get fatigued is when they commonly injure themselves. And not only that, when people get tired and when people get fatigued, they start moving differently, and their muscles may fatigue out. And then, so let's take, for instance, after 30 minutes, he's fine, right? He's fine. He's not fatigued. His muscles aren't fatigued. Then there's no really theoretical increased risk of injury. But after 30 minutes, if he has these muscles getting fatigued and now he's moving a little bit differently and he's a little bit labored, or now he's allowing his knee to fall inwards, then yeah, right? So it really depends on his specific response to time, right? He may be able to withstand a 30-minute limit. He may not be able to, but it really depends on when that fatigue starts setting in, particularly around his hips and his knees, that result in kind of maybe his knees falling inwards and some general bad, body mechanics.
Gotcha. Yeah, I definitely think that's rung true with Joel throughout his career. And I love the guy with all my heart. My biggest critique of him has always been just kind of his unwillingness to kind of take care of his body when it comes to diving across the floor or recklessly trying to block a shot when we're up big and stuff like that, where it's just kind of like business decisions need to be made when taking care of your body. So is the only real way, I guess, is just like being smart decisions and I guess understanding the risk reward for different scenarios when it comes to that kind of thing.
And improving your body. So
Yeah.
It's both, right? It has to be a combination of both improving your body and making the right decisions to not put yourself in a situation to get injured. But I mean, also, he's had injury history, and big guys who have had knee injuries and big guys who have had foot injuries, that's not something that typically goes away. You start having to manage it over time and figure out ways to manage it and deal with it. So yeah, there's certainly some business decision things, but there's also some kind of innate things to him that he has to consistently address throughout his career.
Yeah, that makes sense. And I mean, it's tough for any of us to kind of wrap our mind around. This guy is 7 foot plus, 280 pounds. Just like the stress on his body for making everyday life things is something that like it's tough to imagine that. So I guess I have a hard time.
We're not used to that. We're not exposed to what he deals with for sure.
Yeah, so I have a hard time putting myself in those shoes too. But other than that, I appreciate you coming on and informing us about this. And thank you so much for the opportunity. And anything you want to say about yourself before you head out?
No, I'm good, guys. It was fun. It was fun. I hope I see Ben Simmons again in a Sixers uniform, though. It was fun to watch him play. So
I love it. I love it.
I don't know if that's going to happen, but man, I'm rooting for it.
All right, there you go. So before you go, that's your prediction. Ben Simmons is back in a Sixers uniform at some point.
I mean, Daryl Morey seems a little bit stuck in his ways, right?
Yeah.
So I don't know. I'm hoping for it as a fan. And they gave a little shout out to Ben Simmons during the opening game of the season, saying he's their brother and all. I want to see it. I want to see it on the court, see how that actually plays out.
Yeah, I think that's something we can all get behind. So hopefully Ben Simmons back sooner than later.
For sure.
All right. Well, thank you so much for coming on. We really appreciate it, man. I'm sure you have a super busy day and we're kind of creeping in on that. So, thank you so much for coming on. We'll definitely talk to you soon.
Thank you. It was fun.